Oftentimes we hear this term social determinants of health, which basically means that outside of drugs, doctors, devices, surgeries, there's a lot more that influences one's health. In fact, perhaps most of what influences one's overall health. So you're getting to see some of that as well, I guess. People's socioeconomic status, how they live, their residence, some of the challenges they might have in terms of their housing situation or their family situation. Have you ever thought of the importance of all of that in terms of health before?
Yeah, so as Dr. Wong mentioned, two of our pillars are health system science, which is really the navigation through that very difficult system, and then the humanities. And I actually have, because I'm from the area, I myself have experienced barriers in the healthcare system. I'm from a really small town where we only have a couple doctors and a critical access hospital, so 25 beds. So being able to really experience that in my own personal life has enhanced my experience here because I can empathize. So I have patients who are no-shows, and so no-show is someone that doesn't obviously come to their appointment, and they might do that a couple of times. And then when you call the patient and you say, oh, is there something we can help you with, you realize they don't have a ride, right? It's not that they don't want to come to their appointment, they don't have a ride. And so being that we are training in the community, we're becoming these community-trained physicians and recognizing that medicine goes beyond the basic and clinical sciences. Medicine is the person, medicine is who they are and what they enjoy. And incorporating that health system science and that humanities, it is very important, and it's something that I do believe we really get to see because we are in the clinic and we are with the patient all of the time.
And I would say that the experiential curriculum that these young people are going through is the best way to teach those social determinants. You can talk about them in the lecture, but again, it's out of context. And if they're actually working with people day in and day out who are having these barriers that they come up against, there's no better way to learn it is to do it that way.
Yeah.